Well, today we're going to talk about splint therapy. As you are aware about splints, most of the dentists, when you go to them, you grind your teeth at night, you clench, they make you what we call night guards. What I'm going to introduce to you, the way we do splint therapy due to loss of height or vertical dimension. A patient comes with facial pain. We want to understand if the structural component is in order. And how do we know the structural component? A good analogy will be like having a car with worn tires, and you're going to put new tires. Before you put the new tires, you have to make some alignment. The mechanic aligns the tires so we have balance, so we don't wear the tires further. Now, if you have lost certain teeth 10-15 years prior, you wore down one side of your mouth, your body compensates, your structure changes. As you see in this chart here, this is a skeletal component of the bite, but there is the musculoskeletal component. As you lose height of your bite one side more than the other, you compensate by putting your tongue between the teeth or your cheek, and things go okay till you have more traumas in your life. Now, what I'm going to explain to you as a patient, how we arrive to your true height of the bite, what we call in dental language the vertical dimension, because we don't know what is comfortable for your musculoskeletal system, how we're going to bring back the muscle memory, the height of your bite. I devised the system over 25 years ago, and this has not changed. We start with different special splints, different thicknesses, and it's adjusted according to your skeleton, where the bite should be. As you wear your splints, we try teaching you stretching modalities, and myself or some of my doctors, we do cranial therapy. We try to get your cranial bones adjusted, or we send you to your favorite chiropractor as your chiropractor is working on you, or we are working on your musculoskeletal system utilizing splint therapy and trigger point injections, which is myofascial therapy, which we'll have another section on that. As we are balancing your musculature as you wear this, your bite, your muscles relax, your bite will change, and when you remove the splint, you notice your jaw position is going to the position where your physiology wants it to be. Basically, what we do in our practice, we let your body tell us where it wants to be. As we change the dimensions, we watch your swallow mechanism, your tongue posture, and most your comfort and your head structure. As we arrive to the proper height of your bite, your head posture changes, your neck pain and shoulder pains reduce, and also that affects your low back. Let's presume we arrive to a proper height you're comfortable with related to the height of the splint. It could be third or fourth one. Now we have to make sure that we could have something permanent or semi-permanent, so your chewing mechanism, you could chew with this without having to take these out. We have two technologies we do. One of them is building up your teeth with composite without drilling your teeth, or if the height is so much that we cannot put the composites, we make you a chewing splint. As you notice here, how this individual has lost more height on the right side versus the left side, and he had worn right joint and he has facial pain. So as you wear your overlay or chewing splint and the buildups, we will know if you're comfortable, and eventually these will be the blueprint how we are going to build your teeth permanently, whether it is with prosthetic dentistry or we have to do some orthodontics prior to the prosthetic dentistry. Now, these procedures are non-invasive and they are a part of the diagnostic phase of treatment. That means all the treatments we have done from splints to buildups have not changed your real bite. We did not grind your teeth. And that's the beauty about this technology.